Hi everyone, today we'll be presenting our EEH203 presentation for Assessment Task 2. This is by Andy, Emily, Kira and Patrick. Our task was to develop a rationale to our lesson sequence that answers the question, why should HBPA/LLPA and fitness education be considered to be an integral part of school health and physical education? To effectively answer this question, there are many factors that contribute to fitness education, and we are going to explore some of the reasons. Firstly, looking at anatomy and physiology and the components of the human body, exploring the world of physical activity and fitness, how skill development plays a role in fitness education, how it can boost emotional and mental health and well-being, what are some of the social needs that can be met. By combining all these components, it can provide a strong justification for the importance of HBPA/LLPA and fitness education.
So what does this mean? We're going to start today by looking at HBPA, LLPA and fitness education and how it currently sits within the Victorian curriculum and school settings. HBPA stands for Health Benefits of Physical Activity, in which it addresses the influences and impact regular physical activity participation has on individual and community health and well-being. This is where the curriculum assists in developing the knowledge, understanding and skills to make active choices. This concept is introduced within foundation years and is found in all year level curriculums. LLPA stands for Lifelong Physical Activity, which focuses on participation in health-related fitness and well-being across lifespan and includes fitness activities. It can range from swimming, yoga, Pilates, resistance training or sports. Our group has chosen to focus on basketball as an example of lifelong physical activity. It is typically introduced in Year 3 and carried out until Year 10 curriculum. We're going to look at how these concepts promote different areas of a student's life and are important in a student's education.
Beginning with the anatomical and physiological benefits of HBA/LLPA, Martin and others in 2018 describe anatomy as the study of internal and external body structures and their physical relationships among other body parts. In contrast, physiology is the study of how living organisms perform their vital functions. When a student begins to play basketball, there are a chain of reactions that will begin to occur within their bodies. As they start to warm up, there is an increase in temperature, heart rate and respiratory rate, etc. As a student begins to exercise, there are many effects that occur to the body. The cardiovascular system starts to pump more blood flow around the body. This can cause more oxygen to be transmitted to the brain and improve attention and energy. Furthermore, a range of endorphins are released, often referred to as a runner's high, which can improve mood and function. We're going to take a quick look at the muscle and bone strengthening process.
Called cytokines that activate the immune system to repair the injury. This is when the muscle-building magic happens. The greater the damage to the muscle tissue, the more your body will need to repair itself. The result...
As shown in the video, if a student who plays in a sport team every week consistently places their muscles and bones under pressure, it can help them break down to rebuild a bigger and stronger, as opposed to a student that does not. They will have bones that are thinner and more brittle, increasing likelihood of injury.
Moving to physical activity and fitness, the World Health Organization recommends at least on average 60 minutes per day of moderate to vigorous intensity, mostly aerobic, physical activity across the week. The statistics, however, do not show that these recommendations are being met, with no improvements since 2001, and at least 25% of the world population being rated inactive. It is evident that there is a gap in physical activity and fitness, in which this can be targeted in schools. Our aim is to help highlight why it is important to remain active and what the lifelong benefits could be for students. Therefore, engaging in meaningful lessons that promote physical activity will help to reduce the negative stigma and barriers to student participation, such as fear of embarrassment or failure in front of peers. Corbin shows a method that contributes to our rationale, which is a stairway approach to physical activity and fitness, whereby instead of teachers telling students when to be active, They will become dependent on us to make their active choices. Instead of promoting self-management skills such as goal setting, program planning, self-monitoring, and problem solving, it is giving students an independent approach to their education. Our lesson planning activities aim to promote student participation and enjoyment whilst also teaching skills that can continue outside of the classroom. This helps to create a lifelong skill.
Furthermore, an amazing example of why HBPA is important is the skill development process. A fundamental movement skill can be defined as skills that are required to live and function as a normal human being. It can be argued that without a conceptual understanding of these skills, it can reduce engagement in physical activity and cause poorer health later in life. Students who are proficient in FMS can contribute to their growth, development, and health. A recognised strategy to teaching FMS skills is developed by Hattie. This is direct instruction. In this, we come to a lesson prepared for with clear focus of the learning intentions. We then define success criteria of what FMS proficiencies are, developing a learning hook to help capture the engagement of students, then employing our best practices, either through input or modelling of what the task is. From here, we can then have guided practice, where direct instruction of the drill or the skill is done under direct supervision of the teacher. Then we can follow the guided practice with a game, and finally concluding the lesson with what we have learned and what are the skills that have been applied here.
Many studies have been conducted that discuss the effects that exercise has on mental health and well-being. In these studies, it links the release of endorphins, increased mitochondria, and increased neurotransmitter function. Whilst these physiological reactions are occurring, the physiological effects include reduced stress, symptoms of depression decreasing, and positive effects of self-efficiency. Therefore, mental health issues may not be as prevalent for primary students. They are likely to experience emotional outbursts and uncontrolled emotions. Additionally, mental struggles with themselves. Encouraging students to recognise these benefits and using exercise as an outlet for emotions or to make themselves feel happier. These skills they develop in primary school into managing their emotions can be carried out into their adult lives and are valuable to learn about and encourage. Finally, engaging in exercise is not just about the physical benefits, but also social benefits. Students are able to join clubs or groups and safe spaces where they can play with friends. They get to have regular catch-ups and training to see each other, even out of sports such as doing classes such as yoga, Pilates, also encourages a healthy lifestyle. Some research also suggests that exercise with others versus alone leads to significantly greater pain thresholds, and cues to social bonding prior to exercise improve subsequent performance outputs, with no corresponding increase in subjective fatigue, overall creating an environment to thrive within.
From each of these areas, there is a strong argument for the need of incorporating HBPA and LLPA and fitness education should be considered to be an integral part of school health and physical education. The physiological benefits that students gain from exercise, such as increases in muscle and bone development, stronger heart muscles, improved cognitive functioning, co-opted with physical activity and fitness where students can understand the skills and benefits of participation, exploring the different activities they enjoy and would continue with through to adolescence. Furthermore, the skills students develop within the health and physical education program are lifelong and fundamental to everyday life. Mastering these will assist in confidence and likelihood of continuing an active lifestyle. The mental, emotional, and social benefits are all extremely positive side effects that can come out of fitness education. Understanding there are different sides to being active that promotes different areas of your life. Overall, it is a discipline that should be valued as it connects to everyday aspect of a student's life. Improvements in just one of these areas can cause a knock-on effect to others.